Have you ever felt hopeless? Have you ever felt like, what else is out there? Or is there anything else? Back in October of 2022, I felt that way. But let me back up a little bit. I suffer from chronic pain, from trigeminal neuralgia, from fibromyalgia, degenerative disc disease, from severe arthritis, and a few other things. And I worked in dentistry for 30 plus years, and I would see patients with terrible trigeminal neuralgia, otherwise known as tic douloureux. And that is actually severe pain in one side of your face. It's also inflammation of the fifth cranial nerve in the brain. We also saw patients get teeth pulled because they thought that it was a tooth. Well, over 30 years I suffered with this. And when your pain gets so severe, it can cause depression. And that depression works on you. And it builds up over time. You don't even know you're depressed. And in October of 2022, things happened and stress built up. And the 11th was the turning point, and then on the 13th, I tried to take my life. And my husband called 911, and I was almost DOA. By the time they got me to the hospital, he said, this is what the facts they told me. I was on life support for 16 hours. I went into an acute care facility. I was in there for several days and worked on the issues. I didn't even know I was depressed because I had been fighting the chronic pain, the pain in my face, in my back, in the neck, just the pain throughout my body. I didn't even realize that I had depression. So someone in the facility had mentioned to me, have you ever thought of doing ketamine infusions? Now my husband is a retired veterinarian, and I knew ketamine was used in the veterinary field. And I said, ketamine? I didn't understand what that was, and what they would do with an infusion. So they said, yeah, it's used to treat chronic pain, depression. They explained a little bit to me. So you gotta check it out. So I did. They gave me the name of a doctor in West Lawn. And so I did. I checked it out. I called Dr. Depew, and I came in, and it was the best thing I did. It changed my life. I felt as if a cloud had been lifted. I felt as if I could see the colors again. I had no idea that I was depressed. None. I felt like I had my life back. I felt as if the sky was blue again. I went to hear a concert the following week, and I cried. There was a man singing he was singing a song from an opera, and it brought me to tears because it was the first time I actually heard it for what it was. It was beautiful. my husband said he felt as if he saw the woman that he married again, and it gave me my life back. So what I want to share today is, if you are suffering from something that you don't understand, or you feel hopeless, or you feel as if you can't take it anymore, you just cannot bear the pain, or even you just don't understand what it is, at least call Dr. Depew and talk to him, because he might be able to give you some insight. And look at this with an open mind. Just look at this with an open mind and think, what I don't know, I don't know. Maybe this could be the possibility of looking at new things in your life a different way, because the sky really is blue, and the leaves do change. They're not brown all the time. I love life, and I did not realize how much I thought about dying. I thought about dying all the time, and I did not even realize it until I had the ketamine infusions, and then the thoughts disappeared. So I appreciate so much the people that told me about the ketamine, and I thank Dr. Depew for guiding me through that. My husband was with me the whole time I went through the ketamine infusions, and it took me back to how the trigeminal neuralgia occurred, and it processed things for me. And it was almost as if I had 3 years of therapy in 1 hour of ketamine. And it was just a blessing for me. So open your mind to it. Thanks.